The Canadian Medical Association is sounding the alarm about the concerning rise of harassment and threats of violence being directed towards healthcare workers. The CMA says that they've been monitoring the escalation of these threats and vitriolic messages on social media aimed at healthcare workers, and they are worried that it's only a matter of time before one of these online threats turns into physical violence. And now the CMA is pushing for an amendment to the criminal code and for big tech companies to crack down on this online abuse. Well, joining us live to talk more about this is Dr. Ann Collins, past president of the Canadian Medical Association, Dr. Andrew Boozary, executive director, social medicine at UHN, and Dr. David Jacobs, president of Ontario Association of Radiologists. Thank you all three for joining us. You know, this is a very, very important topic that I'm glad we're discussing here on CP24 tonight. Dr. Ann Collins, how bad is this?
Well, Jamie, we have seen an escalation over the last 2 months where many of our healthcare workers have experienced death threats, racial slurs, misogyny, and it's becoming untenable. Violence against healthcare workers has been around for a long time, but it's really untenable at this point. And so we've made this call. We're calling on the federal government and big tech to take action and accountability to stop the physical and online violence on Canada's healthcare workers.
Dr. Collins, have you had any response from those companies?
Yes, we have. We, in fact, have meetings lined up within the next short while with Facebook, Twitter, and Google. So we are very encouraged to see that there is a willingness to work with us to create a safe space for healthcare workers like my colleagues here this evening who act as educators and advocates.
You know, when it comes to facing harassment and whether it's bullying and just, you know, the vitriol from trolls online, it's really nothing new. But when it starts to cross over into that, you know, threats of violence, that's taking things to a whole new level. Dr. Boozary, I was wondering, you know, you've been open and transparent about some of the things that you've been on the receiving end. Tell us a little bit about some of your experiences. What have you witnessed and experienced from this vitriol that we've seen online?
Yeah, Jamie, I appreciate it. But, you know, I really, you know, to start out with gratitude for Dr. Collins and Dr. Smart's leadership to try to do something around what has really escalated over the last few months. You know, I think sadly, the stories that many of us have around the sort of vitriol or racist slurs or xenophobia, misogyny, is far too common. I think we've seen this especially when there are people who've been involved more directly with the vaccine efforts, or as you mentioned, and as Dr. Collins mentioned, around the education piece and the information aspect. So, you know, I think, you know, it was really hard, I think, early on seeing that kind of response, reading the sort of things you get directly at you, and the sort of threats that are there. And I think, you know, in certain ways you try to, you know, keep moving through it. I think that the leadership from the CMA and other organizations about the sort of supports and protection that needs to be there is absolutely right. And I think for many of us, we just keep trying to be grounded in the millions of people who have stepped up to save lives, to get vaccinated, and have been doing their part and showing, you know, incredible courage in trying to fight this thing.
You know, for many Canadians, they've been, you know, are quite frankly shocked at the kind of the hate that many public health officials have received throughout the pandemic. Those individuals who are like yourself, who are working in hospitals, doing their best to keep people healthy. And Dr. Jacobs, I've been following you throughout the pandemic, and you know, you get quite a amount of trolls directing their vitriol towards you, but you've kind of taken them head on. How big of a problem is this, and why is it that you feel it's important to combat a lot of these people who are just, you know, taking shots at doctors and healthcare workers?
Well, the fact of the matter is that we're in the middle of a pandemic, and we really have to get the message out as healthcare workers, as physicians, with regards to the safety of vaccines, and we have to counter this anti-vaccine narrative. And it's essential. It's an essential part of our role. Unfortunately, however, the online hate and the online threats do sometimes cross over into the real world. And it's something that unfortunately I've experienced firsthand. I haven't made a big deal of it because I didn't want to bring a lot of public attention to it. But I've been doxxed online, which means they put out your public information, your home address and whatnot, and I've had my house vandalized twice.
How scary is that when it literally hits home for you?
Well, personally, I'm a relatively physically capable guy, so it doesn't threaten me as much. But I have a wife, I have small children, and you have to take that into account as well. And we look at what happened out in Red Deer. Dr. Reynolds was viciously attacked and murdered. There are people who are capable of doing great acts of violence, and they can be attracted to the kind of hateful message that we see online. And we have to be aware that this is dangerous. We don't want to wait for something as tragic as what happened in Red Deer to happen because of people advocating for vaccination and public health measures. And it makes a lot of sense for the CMA to step in as they have and to advocate for physicians and other healthcare workers who are the targets of these attacks.
I've always been curious how, the fact that so many of the healthcare workers, all the doctors, the nurses, the PSWs, these are the people on the front lines of the pandemic, those who are putting, the health of others almost ahead of their own. And I'm curious, Dr. Boozary, when, I've seen the work that you've been doing for the last 2 years or so, very selfless work. And I'm wondering what kind of impact this makes on you personally, given the fact that you're trying to do so much good, yet there's just so much hate directed towards healthcare workers.
Yeah, and I appreciate hearing and, concerns and support with Dr. Jacobs. And again, it's far too common as to what too many frontline workers have been facing. And, I think, the obvious piece, Jamie, is that, it hurts. It's tough to see these things where you have to worry about not only your own safety or well-being, but those of your loved ones. And I think, again, depending on what, many of us have faced from, a racialized perspective and the sort of racism and vitriol that's come that way, that's something you never, want to see happen. But unfortunately, we've seen stuff like this happen, pre-pandemic. So I think a lot of it has been, a challenge to get messages like this that are really meant to try to invoke the fear and break this movement down. And I think, one of the things I was fortunate to work with many people in communities and many people who've been out there to push the success of vaccines is that we are getting close to 90% of the population who have been vaccinated. We look at the large numbers of people that themselves have put so much on the line, that have made a lot of sacrifices to see us get through this, whether it's businesses in different community sectors, in different parts of the healthcare system. So I think, there's that emotional, visceral reaction when you get something like that cuts at, your being. But as there's time, you try to ground it in the incredible amount of work that's happening. And that's what gets you up the next day. That's what gets you believing in the fact that this movement is going to continue. And that's what I think we try to ground it in.
Dr. Ann Collins, when it comes to social media, there's always this constant juggle and balancing between trying to keep it a healthy and safe space, but without also trampling on people's rights to freedom of speech. I think we can all agree once threats of violence are, made, that's obviously a red line. It crosses the line for many. What are specific things that you want to see from not only from these big tech companies, but, amendments to the criminal code so that we can crack down on a lot of this, unnecessary harassment and threats of violence?
Well, Jamie, fortunately, we've seen support for this, heard support for this from the Prime Minister. And what we are specifically wanting to see is that it be an offence created within the Criminal Code of Canada that makes it a crime to harass, to intimidate, and to threaten healthcare workers and anyone seeking health care, not only physically, but online. And then, and we really hope to see a strong signal on that this coming Monday in the speech from the throne. With regards to big tech, we are encouraged by their willingness to engage with us. Clearly, their terms of agreement and control measures in place are not working. So we need all of this to come together to create a safe space so that the voices of science and advocacy are safe and not silenced.
Dr. Jacobs, I can imagine that, for a lot of, younger doctors, younger nurses, they might not have been in this business as long as you guys have and might not have developed that kind of thick armor, that coat of skin, that thick skin. What's the message you want to send to some of these younger medical professionals, those in the healthcare sector who are on the receiving end of this vitriol, this hate, especially when they're just trying to get to work? Some of them are walking to work in their scrubs and, comments are being made by, individuals. What's the message you want to send to them who might even be on the fence of, I don't even know if I want to be in this industry anymore?
Well, to them, I would say you're doing the right thing, and you're doing, and you're supported by many. So when you look at the numbers of people who've been vaccinated, you're looking at a 90% plus of the population. So as you're taking all that abuse, know that you're right in terms of the science, know that you're right in terms of doing what's right for the population, and know that the vast majority of people back you. And keep your head up and keep on doing good work.
Dr. Collins, Dr. Boozary, Dr. Jacobs, I'm really glad that we had an opportunity to talk about this important subject, because at the end of the day, you guys are on the front lines of this pandemic, and we appreciate all the work that you continue to do. Thank you for joining us.
Thanks so much.
Thanks for having us.